Opiate use in older adults, a public service announcement by Samuel Palmer. Nursing considerations. Older adults are especially sensitive to respiratory depression, excessive sedation, confusion, and other adverse effects. Considerations include starting with low doses and increasing the dose gradually if needed, monitoring for overdose signs and symptoms, monitoring carefully for sedation or confusion, and monitoring for drug-to-drug interactions that can increase the effects of opioids, such as antihistamines, monoamine oxidase inhibitors, or other narcotics or opiates. Contraindications for opioid use. Opioids are contraindicated in the following situations: respiratory depression, acute or chronic lung disease, liver or kidney disease, pregnancy, increased intracranial pressure and head injury, or severe alcoholism. Patient assessment and monitoring. In assessing older patients using opioids, the nurse should monitor the following due to possible serious adverse effects: respiratory rate, as opioids can cause respiratory depression. The normal respiratory rate for an adult is between 10 to 20 breaths per minute. Excessive sedation caused by the medication. Confusion that is caused by the medication. Possible allergic reaction by monitoring for pruritus and urticaria. Voiding in urine output, because acute urinary retention is more likely to occur in the older adult population. And whether or not the therapeutic effects of the medication have taken effect by assessing the patient's well-being. Patient education. Patient education includes taking the medication only as prescribed. For chronic pain, take the medication on a regular schedule around the clock. Withholding from drinking alcohol or other drugs that cause drowsiness. Not operating machinery or driving while taking this medication. And when a choice of pain medication is offered, use the least amount of the mildest drug that is effective. Correct dosages. A lower than normal initial dose should be used when giving opioids to older patients, especially those who are not used to taking them. Indications for use. The main indication for opioids is to prevent or relieve acute or chronic pain. Morphine, the prototype for opioid agonists, is indicated for post and pre-operative surgery for sedation and to aid anesthesia administration, during labor and delivery, treatment of gastrointestinal disorders, or the treatment of acute pulmonary edema. Adverse effects. Adverse effects for opioids includes central nervous system effects, such as analgesia, central nervous system depression from drowsiness and unconsciousness, decreased mental and physical activity, respiratory depression, nausea and vomiting, and pupil constriction. Gastrointestinal effects include decreased gastric motility and possible constipation and smooth muscle spasm. Thank you for your time.